Hello, my name is Irene Garzón. I'm a midwife and I want to talk to you about an assisted birth. Um, I'm not here to encourage anyone to take this option, but I do understand that in the circumstances we're living now, um, there are people who are going to give birth on their own. They are going to, maybe not even intentionally, but the circumstances that they've got, I don't know, they've got other children, uh, they can't leave them with anybody else, the labor starts really fast. So I think it's a good idea to share with you um, some tips, some knowledge about what to do, what to expect, and how to do it in the safest possible way. Um, Women should give birth where they feel safe. For many women, this place is a hospital, in others is a midwifery unit, in others is at home. At the moment, the demand for home births has increased exponentially, as you can understand, and the independent midwives who accompany home births, most of them are overloaded. They just cannot cover the rest of, well, the demand they're getting now. So for some people, this might be an option. As I said, I'm not telling anyone what you have to do. I'm just trying to help you if this is the option you choose to do it safely. Many midwives do have, in different countries, the issues many midwives are facing are quite difficult about coverage, insurance, and this might be the right time to start thinking about how we could improve the care women receive at home and how midwives can provide this care. As I said, women should deliver where they feel safest. Safe means a different thing for each one of us. But at the moment, with the pandemic that we are experiencing and seeing that the hospitals are starting to get a lot of coronavirus patients, this might not be the best option for some people. I do support all birth options. I think women can make their own decisions about what they want to do with their bodies, where they want to give birth, how they want to give birth. And as I said, I did this video a couple of days ago in Spanish, and well, then I thought that it was quite helpful for a lot of people, so I said, well, let's do it in English now. When a woman is in labor, it starts usually, it's called the latent phase. The latent phase, not everybody experience it, but it would be irregular contractions that are different in intensity, in length, in strength. Then you have one contraction now, then 15 minutes, then 2 mile ones together, then another 20 minutes. Then that's just the way the body is telling you, hey, things are going to start happening. This latent phase can last 2 hours, can last 100. It's different in every person. The way you know you're in labor is when you do have contractions that are intense, they're close together, they last about the same amount of time, and let's say there is a pattern of regularity. Usually when people ask, when do I know if I'm in labor, what's the time to go to the hospital or to call the midwife, I tell them, if you're in doubt, then you're not in labor. So when you're in labor, you're going to know you are. You need to be confident in what is happening. You need to be confident in your body, your power. You need to connect with your baby, to talk to your baby. I don't think if you are very scared of this option, this is not an option for you. I think you should seek help, and you should go and have your baby in a place where you feel safe. So when if you think about before, like I was going to say 10,000 years ago, or 20 or 100, people didn't go to hospitals to give birth, and it was a way, the instinct was the primary thing. It still is. A woman who is in labor is the one who knows best what is happening. If you're feeling something's going wrong, it might be going wrong. If you're confident, if you feel everything is going okay, it's very likely it is going okay. The labor happens this way. The contractions get more and more intense. It's a way of warning us. If you think when we live in caves, it was a way of saying, well, stop walking and stop moving from one place to another. It's time now to find a secure place and stay there, because the baby is going to come soon. As labor advances, you know it's getting more intense, it's getting closer and closer, the moment to have the baby. The most important thing is that people around you are also calm. Oxytocin is the hormone of labor. Oxytocin is also the hormone that we secrete when we're happy, when we're in love, when we have sex, when we orgasm, where we are with a group of friends having a meal and laughing, and that's the hormone, oxytocin. And in labor, it has that as a main function, which is the hormone of love. Is preparing you to love your baby, is preparing your baby to fall in love with you when the baby comes out and born. But also it is it has a mechanical purpose. It's the one that makes the uterus contract to get the baby out. Now, oxytocin, it's needs certain circumstances for it to happen, to come out, and those are circumstances in which you feel, as I said, safe. You feel not observed, not judged. You feel in control. Let's say that to give birth, you would look for a room or environment, the same one you would have sex in. And oxytocin is very shy. What happens is it's antagonistic to adrenaline. Adrenaline is the hormone of fear. It's the hormone when you're nervous, when you get scared, and when one is up, the other one is down. So for the oxytocin to be released at its maximum, the adrenaline has to be low. Not only in the woman who is giving birth, but in the people around her. So if you've got a birthing companion that is nervous, that it's scared, is not going to help at all. So if you're accompanying someone and you have no knowledge of of childbirth, of accompanying someone, probably the best thing is, if you're feeling nervous and you're feeling you're not well, step outside, or get yourself prepared to this. How are you going to cope with your fears? How are you going to be able to not do this? I always put an example. Usually, the hormones that work in childbirth are the same hormones that happen in sex. Exactly the same reactions, the body behaves in the same way, because, well, it's part of the same process. It's the beginning and the end of reproduction. So imagine you're having sex, and all of a sudden your mother-in-law knocks on your window in your bedroom and says, "Hello, where are you? I'm here." What happens with your oxytocin level? It goes right down. Of course, maybe your mom says, "Okay, bye-bye, you're not home, I'll leave." If you were close to orgasm, you're not going to be that close anymore, because your adrenaline has gone up, which means your oxytocin has gone down, and now you need to bring that adrenaline down and start again to get excited, to be able to release that oxytocin and get to that high level. Exactly the same thing happens during birth. Usually things are starting, we're at home. I'm just going to compare this to the people who go to a hospital. Probably is what we can relate the most, especially if you've had children before. You have you're starting to have contractions, you've been timing them, now they are regular, you can see that regularity, that you're having one every few minutes, they're about the same strength, and that's been there for an hour or two. You've taken a shower, they haven't stopped. Then you go to the hospital and you start talking to the midwife, or the person who is who is receiving you in triage, and then said, "How often are you having contractions?" And you say, "Oh, they've stopped. I was having, but when I was at home, I was having them every 3 minutes. And now, since I've been here, I haven't had a single one." That's exactly what has happened. Your body has decided to start birth. It's seen that you're relaxed, that it looks like it's the right moment. And then all of a sudden, that body starts moving, it starts taking a shower, it starts calling the partner, it starts packing the bag, making sure that somebody's coming to stay with the children. So the body says, "Oh, okay, no, I was wrong. I thought it was the right time to start birth, but it is not." So oxytocin stops flowing. To get this release of oxytocin, as I said, the most important thing is that you're safe, that you feel you can do this. However, there is one moment during labor that it's usually at the end of the first stage, when the uterus has to open, and then once it's open, the baby comes down. So when the uterus is opening, at the very end, the woman gets a rush of adrenaline. This adrenaline, it happens at that moment so it can go through to the baby. So when the baby is born, has the adrenaline on and it's alert. It's ready to meet up with mom and to bond with her. So that moment when we have this adrenaline rush, the woman usually feels like she's dying. The woman starts saying things like, "I can't do this anymore. You think you've made a mistake, that this was not a good idea." And you literally, yes, you are feeling that you are dying. This is normal. It's that adrenaline rush. It will pass. If you're on your own, don't worry, it's normal. If somebody is with you, you have to understand that she is not dying, and this part is necessary. Usually before or during the latent phase of labor, you will probably empty your bowels several times, and when labor is advancing, you will very likely vomit. What is happening is the body is getting rid of everything that is not that important in that moment. We have to have the digestive system empty, because everything is focused in delivering this baby. Let's see. Okay, then when the contractions, there is one phase that's when you get that adrenaline rush, is called the transition phase. And the woman might feel a little bit like she's gone to another planet, and it's normal. It's those hormones working well. It's a good thing to try and be there and relax. Don't ask questions to a pregnant woman, to a woman in labor. Have the confidence that if she needs something, she will say, where do I put myself? Do you want some water? Do you want this? Don't. If she wants water, she will say water. If she wants some, she'll ask for it. She might be rude in this time. It's usually quite shameless. That's when she burps, she farts, she might swear, and it's very normal. That means things are going fine. She's completely inside the labor mode, and things are progressing as they should. Then there will be a moment when she will feel probably urges to push. A baby can be born without the woman pushing, so we don't have to tell a woman to do anything. She knows what she has to do. If you feel like pushing, you push. If you don't feel like pushing, you don't push. It will happen. As I said, try to be relaxed, try to be not worried of what is happening. If you feel something is going wrong, as I said, call someone. Look at the ambulance have that at hand before the number of the ambulance in your country. And you can also talk to the person who is going to be with you, like what is right, what is wrong. Look at videos about birth, try to learn about this, the process of birth. So once you start feeling that the baby's coming out, it just feels, you know, a lot of babies are born in the toilet, and the feeling is because it's actually exactly the same feeling. When the pelvis is full of something, whether it's poo or whether it's a baby, the feeling is the same. You have to empty this. So when the baby starts to come out, there will be a burning sensation in the external part of the vagina. That's called the ring of fire, and that's what it's doing, is stopping you from pushing too hard. Babies need to come out gently, slowly. So this ring of fire, which means is because all that skin is stretching, it stings a lot, and that's for you to give pushes slowly. So push out, it hurts. The ring of fire, hold the push, but the contraction is telling you to push. So don't tell a woman what she has to do. You listen to your body, you feel what is happening, and you will be able to do it right. Babies are usually born in 2 times, in 2 contractions. One, what I mean, in many more than 2 contractions, of course, but what I mean, once the head is out, usually the body comes out in the next contraction. So don't pull on the baby, don't do anything, wait. The baby will rotate on its own. It means usually the baby comes facing towards the mother's bottom, and the baby will rotate, looking towards one of the legs. When the baby's born, it's very likely that the mother does nothing, doesn't pick up the baby, doesn't do anything. for a little bit of time, a short time, a minute, maybe 2 minutes. It is normal. She needs that moment. Usually when a woman gives birth on her own without anybody telling her in which position to place herself, she will place herself in a position when the baby is born, she's in a higher position than the baby, like she's squatting, she's in all fours, she's standing, she's kneeling. This is for making the transition of the baby easier, which means the placenta, that the baby is been receiving all the oxygen the baby needs through the umbilical cord. The placenta is working still and is doing now its most important job. That is just helping that baby with that adaptation to the external life. So in that moment, that moment that the mother stops, it's usually for her to give deep breaths to oxygenate her blood really well, so it goes oxygenated blood to the baby. The babies are usually born with a color that it's a little bit scary. Okay, they're born a little bit blue. It will take the baby a little bit of time. You will be able to see how it works. Your instinct will tell you if you need to do something and what you need to do, but probably you will see that if the cord of the baby is blue, is full of blood, is thick, and you can feel that it's blue and full of blood, it's very likely that everything is going okay. A baby just needs a little bit of time. Then the mother will pick up the baby, will put the baby close to her, and the baby will start the breathing process soon. Some babies breathe straight away, even start crying the moment they're born. Some others don't. The tone of the baby is very important. Obviously, if the babies are very, very floppy, like they have no tone, you can see in the muscles they're completely like dead. You need to wrap your baby and just do some vigorous rubbing. You should have a couple of towels with you, so when the baby's born, you put a towel on top of the baby, and then change that for a warm one. You can put the towels on a heater, on a radiator before you're in labor, when you start to be in labor. Now it's telling you, instead of telling you go to the cave, it's telling you get the towels and get everything ready. Now it's very important, and the placenta will come after. Usually the placenta, there is bleeding between when the placenta separates. The placenta is embedded in the uterus like the roots of a tree. So when the baby's out, the uterus decreases in size, because obviously the baby's out and it's a muscle that is around the baby. So when it decreases in size, the blood vessels between the placenta and the uterus start to get cut because of this. The fibers of the muscles cut these blood vessels. So there is some blood that comes out. It can be quite alarming. But it will cease. It will stop. So, and the blood of the placenta separation, it's quite dark. Now, I've forgotten her surname. I know it's Joy. She's the one who has done a video about complications, about shoulder dystocia, hemorrhage, or anything what to do if those things happen in an unassisted birth. So I'm not going to go into that. I just want to say that it's very important that for the placenta, you let it come out on its own. It might take up to an hour. Maybe the mother is there with her baby, and after a while she feels contractions. Yes, that's, again, the uterus doing the right thing and contracting to separate the placenta. You will feel again, that the pelvis gets full, so you will push the placenta out. Sometimes you even stand up and the placenta falls out. Don't pull on the placenta, don't pull on the cord. That's really, really important. The placenta has to come out on its own. But the most important part for hemorrhage not to happen, it's for the moment the baby is born. That moment between the mother and the baby has to be left just for the two of them. Do not interrupt that moment. Do not do anything. Just let them be. The same with the mother. Don't think, bring me this, go and call the children, go. No, that moment is for you to fall in love with your baby and for that peak of oxytocin to reach its maximum. Not only to bond with your baby and you both fall in love with each other, but also for your uterus to get the placenta out, for your uterus to remain contracted, and for you to not bleed more than you should. I will put you, when I load up this video, I will put in comments where you can find extra information about this. Now, it's very important that moment, that when you are with the baby, looking at the baby, smelling the baby, kissing the baby, that's what it's going to make that oxytocin flowing. Now, the moment in our life when we have the most oxytocin is right after giving birth. It doesn't matter the only thing we can compare it with in the amount of oxytocin that we produce is when we have an orgasm. When we've had a baby, this oxytocin release is much, much, much higher. And that's why it's so important that we do not alter this, we do not do anything at all. I hope, I will try to put this on Facebook. I hope that if you have any questions, just ask me. I hope this is useful for anyone, and I just wish that everyone keeps safe. Probably I will have forgotten something important. I was going to say, don't do anything with the cord, with the baby's cord when the baby's born. Don't even cut it, at least until the placenta is out. So if your baby is going to need anything, any help with the start in life, is much better if the baby is attached to you. That's actually the what is providing the baby with everything baby needs during that time. And then you can put some sterile cord or have some clean cord prepared to tie it. You tie it into parts, so you put here and here, and then just cut it with a pair of scissors. How to sterilize something? Boiling water, you make your scissors there. I would even say just boil them when you start with the contractions, and cover them, boil them for half an hour, cover them, put the lid, and leave them untouched until you need to use them. And all the best, be safe. I hope this is useful to you or to anyone that might have to consider this option.